My name is Dr. Anil Kumar. I'm platform presentation regarding thesis a study on clinical features and complications of scriptitis in a tertiary care institute in AP or Dr. B. Siddharth Kumar, Dr. M. Babu, Dr. Usha Kalawat. Introduction: Scriptitis is a rickettsial infection caused by Shishko-Musli disease. Scriptitis is widespread in so-called Shishko-Musli triangle. Although epidemic to India, Scriptitis remains under low suspicion, non-specific clinical presentation, and a lack of access to the specific diagnostic facility. When the diseases of acute febrile fever due to localized causes were excluded, a good percentage of these cases were ultimately diagnosed to have scriptitis. Complications associated with scriptitis are many times fatal. Public health importance of the disease is underestimated because of difficulties with clinical diagnosis and lack of laboratory methods. Scenario in mind. Aims and objectives: to study the clinical features and complications of patients associated with scriptitis. Materials and study: prospective and observational study. Consecutive patients who were admitted into the various wards of Sri Venkateswara Institute of Medical Sciences between March 21 with IgM positive scriptitis were enrolled for the study. Inclusion criteria: all consenting patients above 18 admitted various wards of Institute of Medical Sciences with IgM positive scriptitis. Exclusion criteria: patients who were positive for other common associated typhoid and malaria, and patients who are unwilling to participate in the study. Regulatory clearance: the study was conducted after obtaining clearance by institutional ethical committee. Study procedure: a detailed history and clinical examination regarding symptoms and signs of options of headache, cough, dyspnea, scar, rash, lymphadenopathy, jaundice, oliguria, altered sensory neck rigidity, bleeding, hepatomegaly, complications like myocarditis, pancreatitis, ARDS, MOTS, meningoencephalitis, shock and mortality also. List of investigation done generally renal failure, renal function test, liver function test, ECG, 2D echo, bleeding time, clotting time, PTINR, chest X-ray, ultrasonography, brain or MRI and CSF analysis. Diagnosis of scriptitis is done by lateral flow format immunochromatography test for the detection of Orientia Shishko standard protocol established by the institution. Statistical analysis. Data were recorded on a design using Microsoft Excel worksheet. All the entries were double checked for any possible error. Descriptive statistics for categorical were presented as the continuous mean plus or minus standard deviation, median interquartile range. Statistical software IBM SPSS has been analysis. Results: study period March 2020 to March 2021. Consecutive adult patients who are IgM positive 70 patients screened for the study. 20 patients were excluded. Among these, 18 were dengue and leptospirosis positive, and 2 are not patients included in the study. Results: the equal distribution of male and female. Age distribution among the 50 patients 18 to 40 years of age, and geographical distribution mostly among Chittur high geographical distribution of scriptitis. Coming to clinical presentation, most be patient having fever around 100% of the patient, followed by headache, and least common should be most of the patients who are presented with scriptitis having the most thrombocytopenia, around the 30 patients function, and least possibility should be elevated serum amylase and lipase. Complications around which is around six members of the in the study having presented with acute respiratory distress syndrome. For these should be This presented by pancreatitis and myocarditis. Results. Most common clinical feature in this study was for 100 per week. It includes 43 members. Most common complication in the study was acute respiratory distress syndrome, followed by multi-organ dysfunction. Similar studies which were included in Thakur et al., which is in 2014. 2016. Thakur et al. Compared to Thakur and Philomena et al. In Thakur et al., it is observed study. Sample size below less than 100 in all the three studies. Coming to male to female ratio, in Thakur et al. Study, it is 0.57:1. In Philomena et al. 0.1:1. Clinical feature and complication in all the three studies would be same. Most common clinical feature is fever, and most common mortality in my study and Philomena et al. Study is equal 6%, and